Welcome to The Explainer. We're jumping right into something that's honestly a huge game changer for chronic pain. We're talking about redefining recovery, the science of shockwave therapy. If you've been dealing with stubborn injuries and just want a cutting-edge way to heal, well, stick around because this is going to open your eyes to a seriously cool, non-invasive solution. Let's get right into it.
So, are you not getting help with chronic injuries? Look, it's incredibly frustrating, right? Dealing with stubborn musculoskeletal pain that simply won't go away. It doesn't matter how much ice you use, how long you rest, or what traditional treatments you throw at it. You just feel stuck in this endless loop of discomfort. And, we aren't just talking about a minor little ache here. We're talking about common, stubborn conditions. Things like plantar fasciitis making literally every step hurt. Tennis elbow, rotator cuff injuries, Achilles tendinopathies, and even carpal tunnel syndrome. These are the injuries that really linger and just totally disrupt your life. If any of that sounds familiar to you, you're absolutely in the right place.
Section 1. What is shockwave therapy? Okay, so here's the core definition. Shockwave therapy is a non-invasive, non-surgical modality utilizing short bursts of acoustic wave pulsations to accelerate healing and repair injured tissues. Now, the absolutely crucial phrase there is acoustic wave pulsations. I really want to highlight that. Acoustic. We are talking about sound waves here, not electric shocks. It's a completely non-invasive way to jumpstart your body's natural ability to heal. And this has such a crazy origin story. As the quote says, shockwave therapy arose from the concept of breaking down kidney and gallstones through low-energy wave pulsations. Literally, medical professionals had this massive light bulb moment where they realized, hey, if these acoustic waves can safely break down calcifications deep inside the body, we can calibrate them to stimulate tissue healing in sports medicine too. It's just a brilliant evolution in science. Section 2. The science of healing. So how does it actually work? Well, it's a 4-step chain reaction. Step 1, acoustic waves penetrate the tissue. Safely, of course. Step 2, and this is the really cool part, micro-cavitation bubbles form. Step 3, because of those bubbles, blood circulation and vessel formation increase. And finally, step 4, tissues and bones regenerate. Basically, you get this massive rush of fresh blood and nutrients, and you're essentially tricking your body into restarting the healing process right at the cellular level. So, what do these key therapeutic benefits look like in the real world? Well, because of all that targeted blood flow, it drastically reduces chronic inflammation. It provides highly targeted pain relief right at the exact source of your issue. Over time, it improves your mobility. And honestly, one of the best parts, it reduces your reliance on anti-inflammatory medications. You're just healing naturally, but way, way faster. Section 3. Radial versus extracorporeal therapy. Now, there are actually 2 different types of this tech. First, we have radial shockwave therapy. This uses a pneumatic system where the waves spread radially from the skin surface, kind of like ripples in a pond. It's perfect for treating superficial conditions, like tennis elbow. On the flip side, we have extracorporeal shockwave therapy, or ESWT. This uses high-energy waves generated outside the body to target deep tissues, and yeah, kidney stones. So basically, the depth and the energy level dictate exactly which tool gets used for your specific injury. Section 4. The patient experience. Okay, so what does this actually look like if you go into a clinic? Here's the timeline. Day 1 is a 45-minute initial assessment. A pro checks out your history and does a full physical evaluation. Then, during weeks 1 to 6, you go in for subsequent 15 to 30-minute treatments. Notice how incredibly short those are. And post-session, most folks see a progressive, noticeable reduction in pain over just a few weeks. It's super efficient. The standard treatment protocol is usually 1 to 2 visits per week for 3 to 6 weeks, depending on how stubborn the injury is. And it's worth noting that these sessions are super often combined with manual therapy or chiropractic care. So it's part of a whole comprehensive recovery plan, rather than just acting as a standalone magic wand. Now, I know exactly what you're wondering. Is the treatment painful? It's probably the biggest myth and the #1 thing people stress about before trying this out. So let's talk about managing session comfort, because I want to reassure you here. You'll generally just feel a mild, tolerable discomfort during the acoustic wave pulses. And here's the kicker, the machine intensity is easily adjustable by your practitioner. So if it's too much, they just dial it down. Afterwards, you might have some mild post-session soreness, kind of similar to how you feel after a really vigorous workout. That soreness just means your body's doing its thing, and it subsides within 1 to 2 days.
Of course, to be completely transparent, there are some contraindications to keep in mind. You shouldn't use this if you have circulation or nerve disorders, active infections, bone tumors, or metabolic bone conditions. It's also a no-go for open wounds or during pregnancy. But hey, that's exactly why that first assessment is so crucial, to rule all of this stuff out.
So as we wrap up this explainer, I really want you to ask yourself, is it time to redefine your recovery from chronic pain? If you're tired of living with a stubborn injury, or you feel like you've totally plateaued with standard physical therapy, this acoustic wave technology might absolutely be the breakthrough you've been waiting for. If you're in the Vancouver area and want to check this out, NW Rehab is the place. They're at 2830 Main Street in Vancouver. You can call them at 604-875-9779 or just book online at nwrehab.jnap.com. Thanks so much for joining me for this explainer today. Keep learning, keep moving, and here's to getting you back to a pain-free life.